When you have kids, even minor medical problems, cuts and bruises, coughing, crying, sometimes it can seem like a potential disaster. So how do you know when it's really time to take your child to the ER? Our Dr. Jennifer Ashton is back with some guidelines this morning. Good morning.
Good morning, Harry.
So one of the things you say, especially with babies, is what you want to keep in mind is their routine. Why is that so key?
And this can be a little anxiety producing for new parents. However, babies, what do? They eat, they sleep, they poop, and they pee. So those are the 4 jobs that they do all day long. If there's a big change in any of those things, you want to talk to your pediatrician. So for example, a baby who's eating every 2 hours that then goes to only taking bottle or breast milk every 4 or 5 hours, you just want to give your pediatrician a call, find out if that's normal.
Yeah.
Those can be very important
Especially
signs.
those other body functions, if they stop, then that's
Absolutely. Wet diapers is very important, and number of bowel movements. Again, it can vary based on the baby, but they should be consistent for that baby.
One of the other things you say you ought to cue in on is crying inconsolably. Now that happens with babies.
It absolutely does.
But what kind of time frame are we talking
And it's
about?
particularly common in babies who have colic or who tend to be very
Sour
irritable.
stomach, we used to call it.
But most of the time, the pediatricians will say if your baby is inconsolable for 3 hours or more, again, you want to talk to them. It doesn't necessarily mean you have to rush them into the pediatrician's office or the emergency room, but it can be a sign that there's something going on, even as simple as gas. It doesn't mean there's some disaster brewing, but most of the time, within a period of about 3 hours, you can calm a baby down, even the most colicky baby.
Remember when some fathers I knew used to put their kids in the car and drive them
and we
around.
did that too,
Okay,
absolutely.
all right. Toddlers. Hurt toddler. Mechanism of injury. What does that mean?
Now, this is a term that we borrowed from the trauma literature, and it's a fancy way for saying, how did the injury occur? So a toddler who's walking or crawling and falls on their tush, that's a different mechanism of injury than someone who falls, let's say, from a 12-foot height on a jungle gym, and that can be important. So again, you want to take that into account, and again, if there's any big deviation in the child's behavior or how they're acting, speak to your pediatrician.
So especially injuries that might happen in normal sort of what toddlers do, right? But if the kid's on top of the chair.
Exactly, or riding a bicycle even for an older child, going at a high speed or down a hill and they suffer a fall at a high velocity or speed, that's very different than someone who just trips on a road.
And that's very important to keep in mind when you're communicating with your physician.
Exactly, you want to tell your doctor how the accident happened if possible.
Okay, you have another thing called the ABCs being important, especially for toddlers. Which ABCs?
Now, that's right. Also from the trauma literature, normally doctors will refer to that as airway, breathing, and circulation. Here we're talking about airway, bleeding, and color. So a child that's having difficulty breathing or finding a coughing or making a different sound when they breathe, that could be significant. Bleeding that does not stop with constant direct pressure over a period of as long as a half an hour. Don't keep checking it. It's still going to be bleeding. But bleeding that doesn't stop in that period of time, you want to speak to your pediatrician. And again, color. A child normally is pink. When kids get sick, they can get on a little bit gray, greenish, but if their color looks bad to you, blue, gray, green, and it's not getting better, you want to speak to someone.
Really good tips, Dr. Ashton. Thank you so
much.
And
the mom.
Okay. For more on kids and emergency rooms, go to our website, earlyshow.cbsnews.com.